Hello, everyone. We're at Tri-State Media Services, and we're in Lexington, Kentucky today, and we're here with Ryan Bethay. Hi, Ryan.
Hi.
He is with BrightStar Care. And Ryan, would you tell us a little bit about BrightStar Care?
Yeah, absolutely. So BrightStar Care, I'm the owner of BrightStar Care here in Lexington. BrightStar Care is a home care agency, and what that means is we bring home services to the client where they are. So any type of personal care needs, we talk a lot about ADLs, activities of daily living. We even do nursing care. We can do all of that wherever their client lives. So whether that be in the home or in an assisted living facility, some type of retirement community, we can go wherever the client wants us to.
So you can go in even nursing homes and stuff too?
We can. Mm-hmm.
Oh,
yeah, if that's where the client lives, that's their home. So absolutely.
And go into detail a little bit about what all that you do offer.
Sure. So we kind of look at BrightStar. It's complicated,
Okay.
but if you really look at it, there's two avenues.
All right.
People are classified, or our clients kind of fall into two different buckets: a non-skilled and skilled. So our non-skilled is what we consider those personal care needs. So you have grandma, grandpa, they can't bathe themselves anymore.
Right. Okay.
Or they're having a lot of falls in the home. They need some help to make sure they aren't falling. Reminders to take their medications, to make sure they're eating, bathing, toileting, all of those,
Yes.
personal care needs is what we would classify as non-skilled care. So we do all of that. We train our caregivers to operate at their highest extent that they possibly can.
Awesome.
So we have a training facility here in Lexington where we take them through every aspect that they could think of. We train them on using Hoyer lifts. So if someone can't walk or bear weight, they can use a lift to lift them up, to transfer them from the bed to the chair and wherever else they need to go.
Okay.
Any type of sliding boards, any type of medical equipment that could be used in the home for someone to meet their daily needs, we train our caregivers to do. So that's kind of the non-skilled side of things.
Okay.
So we offer all of those services. On the skilled side of things, which is unique, usually home care does not provide skilled services. However, BrightStar Care does.
Awesome.
We can do anything a nurse can do at the hospital. We can technically do it in the home. So we do a lot of wound care. Someone has, a bed sore or is coming home from a surgical procedure and has a wound. We can do wound care at home. We do infusions in the home.
Oh, wow.
So
That's good.
if someone is dehydrated and needs an infusion or some type of medication that has to be done IV, we can do that in the home as well.
Wow. So you've got RNs, LPNs. You offer all that?
We have RNs, we have LPNs, depending on what needs to be done with the patient, depends on their license and who we would send out to that patient. And then on the non-skilled side of things, we have, in the state of Kentucky, you don't have to be certified to be a caregiver.
Okay.
But we have caregivers, and then we also employ CNA, so certified nursing assistants, medical assistants, home health aides. There's a lot of different certifications to go back and get their to be certified as a caregiver.
Wow, there's a lot that you offer then. Now, I noticed on I got on your website a little bit and checked it out. You offer childcare too?
We do. So that's, when I opened up BrightStar Care, I came from the hospital myself. And so I've been a nurse since 2014. And I joked with everyone, I worked from diaper to diaper. So I worked in the NICU, taking care of infants that are in intensive care, and then I worked in medical ICU. So I took care of 90-year-olds that are in ICU, but they're all in diapers. So when we opened up BrightStar Care, I wanted to be able to provide services throughout the lifespan. And so we do offer just regular babysitting services. We have different contracts actually with the state that we can provide some more hands-on services that children need throughout the state. And then we also do private duty nursing for children that have Medicaid.
Oh, wow.
So children that are being discharged from NICUs here at University of Kentucky Hospital, we provide nursing services for them.
That's awesome. I know we've got University of Kentucky down in Ashland.
Yeah, King's Daughter, right? Yep.
Yes, and you all can offer that service in Ashland, right?
That's correct.
Or our surrounding, because we're right on the corner of our, Ohio, Kentucky, and West Virginia, all three. Are you certified in all three of them states to be able to do that?
That's interesting that you asked that. I actually just had a call from a patient right in the West Virginia area.
Right.
But like, I could understand that you could walk there from Ashland.
Okay.
So I actually reached out to the state to find out if that was allowed. And we just have to get approval from that state over. So
it's probably Canova, maybe. Was it Canova or Huntington, maybe?
It wasn't Huntington. My wife actually went to grad school in Huntington, so I know
At
she went
Marshall?
to Marshall. So I know Huntington, and I know it wasn't Huntington. I'm not sure where he said it was.
Canova,
but,
maybe. Yeah.
what I understand, and I'm working on the legislation right now, is that you have to just get approval from that state.
Wow.
So Kentucky has no say in it. I would just have to get approval from either West Virginia or Ohio
That's
for us
awesome.
to come over there and take care of that patient.
So how long has BrightStar Care been in business?
Here in Lexington, since 2023.
And what about the company itself? How long has it been?
Oh gosh, BrightStar is a franchise.
Okay.
So I think the original franchise, I want to say opened in, I'm honestly not sure, but I want to say sometime around 07 or maybe even earlier.
Wow. So it goes way back.
So it's been
Good, reputable
absolutely
company.
Yeah, well, that's one of the reasons why I purchased here in Lexington. So one thing that makes us unique from other home care agencies is that it is mandated that we have to be Joint Commission accredited.
Okay.
Now, what that means is that it's a outside governing agency that comes in and audits us. So we've already went through ours back in August of 2024 or 2024. They came in and audited us. It took 2 days. So they're pulling files, they're checking your documentation, they're making sure all your HR files are up to date, everything. So you mentioned like the quality and reputation of BrightStar Care. That's one of the reasons I opened up BrightStar Care here in Lexington was because of that quality of care that they clearly, obviously, stand on. If it's mandated that I have to be Joint Commission accredited. We're the only home care agency that does that. No one else does that.
Right.
And there's a reason. It's because it's hard. Usually you only think of hospitals and, rehabs and nursing homes that have to be Joint Commission. They don't have a choice. We're a glutton for punishment, I guess. We invite them to come in and audit us.
Now, is that like being bonded? I'm not sure. This is a question that I'm curious about.
That is not like being bonded, but BrightStar Care is bonded and insured.
Okay, so that's good. And like if they go in the homes, that's insured.
That's one of the things that I talk to about patients a lot of times is that because it's no secret, agencies are more expensive than the private caregiver.
Exactly.
And I get it, times are tough, and I understand that. But you put yourself at high risk when you are privately paying for a private caregiver to come into your home and take care of you.
That's where the bonding comes from.
That's where the bonding comes from. Because if something happens to that employee while they're in your home and they fall and get hurt, it's your responsibility to pay for their medical bills.
Right.
With an agency, yes, you're paying, several dollars extra an hour for that employee, but when something bad happens, it's my problem, it's not your problem.
Right. What got you into BrightStar Care? What made you want to open your own business?
So I was working at the university here as a nurse, like I said, in different ICUs. And then I went into management there. I was a coordinator for one of the departments at UK for 4 or 5 years. And then I just wanted to do more for the community. I wanted to bring healthcare to areas that hospitals miss. I mean,
Right.
they can't, do
Exactly.
everything. They're limited to their brick and mortar. Like, you have to go
Exactly.
there.
Exactly.
With BrightStar, we're not limited. This office is our only brick and mortar, but, we can go, like I said, to the patient. So we can
Right.
deliver care and meet people where they're at.
Are you eventually wanting to open up different BrightStar Care brick and mortars? I guess I should say.
Yeah, I mean, it's on the 10-year plan.
Yes.
I have big goals for us. We're already, like I said, we had the opportunity to go into Ashland and to take care of a
Yes.
patient there through a workers' comp contract that we have. So, that's originally what got me interested in the Ashland territory, and now that we have staff there, we're trying to bring more services to that area.
Okay. How do people find out about Bright Care? I know there's a website you can go to, and there's phone numbers that they can call. Would you like to let people know that?
Yeah, absolutely. So you can go to our website. It's brightstarcare.com. That will give you all the general information that you would want, and then on there you can search Lexington, and it'll pull up our agency. It'll give you our numbers that you can call, and anyone in my office can answer any of your questions. We're also 24/7 answering, so if you work, until 9 o'clock at night and you're just, seeing it and at night, you can call us, and someone at the office will pick up the phone and be able to answer your questions.
Now, do you offer any special deals for like per day, or is it per hour? How do you all handle that part?
So payer source gets complicated.
Okay.
So when we broke it up into our non-skilled category and our skilled category.
Right.
So non-skilled category is going to almost always be you have to pay for out of pocket.
Right.
Medicare says they are not going to pay for non-skilled items, although a bath is needed in my opinion. But
Oh, exactly.
there's nothing we can do about that. But so with that, we charge by the hour.
Okay.
So most of our services, the way the whole process starts is we send out a registered nurse to come out and meet a new patient, and we do a whole nursing assessment of that patient to find out, their medical history. What are they at risk at? What complications do they have that could send them back to the hospital?
Right.
So we identify all those needs and all those reasons why they need care,
Right.
and we create a plan of care for them.
Okay.
So depending on what that plan of care is, we then can understand, like, okay, well, if we need to do all these services, that's going to take 3 hours a day type of
Right.
thing.
Okay.
And so most of our services do run by the hour.
Okay, I'm going to ask you about the assessment part of it. Now, does that cost anything as far as, like, you send your nurse out or whatever, and it doesn't cost the patient a thing?
Correct. Yeah.
Awesome.
So,
That's amazing.
We call that our living room visit process.
Okay.
And usually, that's when they've already called, and we've talked to them over the phone, and they realize that they need help in the home. And so, that really starts the whole process. So, no, we do not charge for that. With BrightStar Care, since we do offer that skilled side of things,
Right.
All of our non-skilled patients, so, grandma has dementia and just
Yeah, I
can't be
was gonna
left
get
home
that.
alone
Yeah.
or something. So, they don't need a nurse to come in and do a wound care. They need a caregiver. So even our non-skilled patients have registered nurse oversight.
Nice.
So at the beginning of care, and then also every 90 days at least, we're
Right.
sending out a nurse to do another reassessment.
Right.
And that's just to elevate our standard, to make home care to be a quality service that is preventing hospitalizations.
Right.
That is keeping people out of the hospital just completely, and
Right.
managing their the aging process at home.
Right. So you can send in a nurse, whether, say a caregiver, and that your caregiver thinks that you might need a nurse, you can send a nurse out and have them evaluated and stuff.
Absolutely. So like just today, one of my caregivers called and said, hey, like this is their blood pressure, and it
Yes.
was a little bit lower.
Okay.
So we were like, per the doctor's orders for this patient, we know to hold the blood pressure medication if it's below this.
Okay.
Now that takes a nurse, not a caregiver. The caregiver is there, taking the blood pressure and just reporting back to the nurse that's in charge of that patient.
Okay.
So the caregiver calls the office and says, hey, this is the blood pressure, what do I do? We look at the doctor's order and we say, you need to hold his blood pressure medication that's below the threshold. And so that's kind of how the caregiver-nurse relationship works
Awesome.
with BrightStar.
And so the caregiver has some skills to be able to do stuff like that. Take
Yeah,
temperatures, do the blood pressure. What else can they?
They can bathe. The caregivers can
Bathe.
do a lot,
Yeah.
and we train them at our facility. They can take vital signs. They just can't assess a vital sign
Okay.
and what to do. They can take a vital sign and report the number.
Right.
They can bathe. They can do medication reminders, and so like with a dementia patient, it's hey, it's noon. Here's your lunch, and you remember to take your medications at noon.
Now, is there like light housekeeping that can be included in that too?
Absolutely. Yep.
Awesome.
So that is absolutely something that we do. Keeping the home a clean environment is
Right.
very important to health, especially in the elderly. And so, yes, 100% light housekeeping, dusting, sweeping, doing laundry, dishes, all of those services are included.
I know you mentioned Alzheimer's and dementia, and there seems to be a lot of that nowadays. So you have the caregiver can do that, right?
Absolutely.
The Alzheimer's and dementia, and then if needed, you can have a nurse assess it.
Absolutely.
That is a big thing in our area, in Ashland, in the area. We've got a lot of Alzheimer's and dementia patients there.
Okay. One thing that I want to talk about then is, so like I said, a lot of those patients are going to be under the non-skilled category.
Right.
So if we think about the non-skilled category and think about, okay, how are these individuals going to pay for this? So that is going to be paid for by out of pocket. However, the government has created a program called GUIDE.
Okay.
Just spelled just like it sounds, GUIDE.
Okay.
You can go online and you can look up GUIDE, and it will give you a certain dollar amount if you qualify. You have to have, a physician formally diagnose you with Alzheimer's or dementia, and there's some other criteria.
This is just for seniors only, or?
Yes, for seniors only, and you have to have a dementia or Alzheimer's diagnosis.
Okay.
And there's some other criteria too, so make sure you go online and look.
Okay.
But you could be eligible for up to a certain dollar amount a year
Wow.
in
That's good.
caregiving services. So what that would mean is, if you qualify and you get these hours, you could get a caregiver to come in and take care of your loved one with dementia or Alzheimer's for a certain amount of time. It's called respite hours.
Okay.
So let's say that your mom has Alzheimer's and she lives with you, but you're going out of town for a wedding,
Okay.
and you can't leave mom by herself.
Right.
You just need care for a short amount of time until you get back home.
Yeah.
That's what we call respite.
Okay.
And that's what this program is for, is to provide you, the primary caregiver,
Right.
because that's what you are if you're living with a loved one with this disease, a relief for a certain period of time. So the GUIDE program does offer that, and that it would be a benefit to you with whatever type of insurance you have. But like I said, you do have to qualify and you have to meet all the criteria to get that benefit.
And can they go online, did you say, to
Yep,
check
go
that
online.
out?
You can Google GUIDE program state of Kentucky. It'll pull right up and you can start looking at all that information. If you have Alzheimer's dementia, or if your loved one has Alzheimer's dementia and you want to call us, we're happy to walk you through that process. We have
That'd
a
be
portal
awesome.
that we have to get some demographics and your insurance number and everything. But within 24 hours, we can tell you if you're going to qualify for it.
I'm glad that you mentioned that, because a lot of people don't know the steps to do.
It's very confusing.
Yes, it is. Very, very.
Senior aging and senior care is it's a full-time job. And well, that's why agencies like mine exist, because it's a full-time job. It's very confusing, and it's easy to put off.
Right.
But that's the problem. We get the phone call that, we've put it off, we put it off, and we put it off, and now we're in crisis mode. And that's what we try to do, is try to prevent crisis mode.
Yeah, we went through that with my dad 3 years ago, and they offered some things, but my stepmother did not take advantage of that, and it was hard. It was hard to see your dad or your mom, either one, going through that process. And I'm sure having you all around would make a great opportunity for them to be able to do other things too, like offer the care to come in and sit while she would go out and do things.
Yeah. I mean, even just to, the salon. Heaven forbid, if someone get their hair cut without having to worry about
That's little simple things that people really miss.
It's simple,
when
but
you're
it's
going
huge,
through that.
Because I mean, I watched my parents, go through the aging process with both sets of. I was lucky enough to have both sets of my grandparents alive, and for most of my life, they're all gone now.
Right.
But watching them navigate it, it's taxing on the individual.
It is.
Grandmother just passed a few months ago from dementia, and
I'm so sorry.
It was hard watching my mom go through it, and the stress that it puts on the family members.
It's still stressful just thinking about
Sure.
it. What about disabilities? Now, the people with disabilities, you all can take care of those patients also, right?
We can, yeah. We can absolutely take care of an individual with disability. There are some different Medicaid waivers with the state that you can get on with disabilities. Now, we are not a waiver provider at the moment.
Okay.
But if you're not getting the services that you want with that, we absolutely can. It would just like you were talking about earlier, that hourly charge for someone with disabilities.
Right. Now, are you wanting to spread all over the state of Kentucky? What are you wanting here, Ryan? Tell us, please.
That's the
Come on now.
$1 million
Let us
question.
know.
I don't know. Every day is very different in this business. And I'm a man of faith, and I truly believe that every opportunity is from God, and is just telling me where to go and what to do.
Yeah.
I knew of Ashland because I drove through there because my wife went to Marshall, so I know where Ashland is. But never did I think I would have a patient there until we got an opportunity with a workers' comp claim and just kind of took us there naturally, and then I met you guys, and so I guess to answer your question, if the growth across the state is that organic and natural, then sure, why not?
Yes. Shout out to Nikki for setting this podcast up. Thank you, Nikki. She was very animate on this too, because she believes in the company.
Yeah, Nikki's great. Nikki had helped us out a lot. She's a great caregiver. I would let her take care of my grandma if she was still alive.
Now she does it in the Ashland area.
She does, yes.
Now, does she travel outside of Ashland, or?
I'm sure she would if we asked her to.
Yeah. Do you have any more caregivers in the area right now?
We do.
You do?
Yeah, we have caregivers in that area that are looking for work and looking for more patients to take care of. Nikki's kind of spearheading, doing some outreach and talking to different people, and how we can make our services more aware of our services. In the
this
area.
will reach a lot of people, so hopefully your company will spread.
Yeah, absolutely.
Is there anything else you would want to say before we leave?
Not that I can think of. Do you have any more questions? Or
I think we just about covered all the services that you offer. I was looking at your page, and I noticed the dementia and Alzheimer's, and the in-care and out-care, and all the the Childcare was the biggie. I thought, wow, you all offer Childcare?
Yeah.
That's amazing that you all do that, because it's hard to find Childcare. There's all kinds of people on Facebook asking for Childcare.
Yeah. And
'Cause
so,
you
I
can't
mean,
get in
we
these-
do vet all of our people to, you know, to the highest extent that you can.
Mm-hmm.
We run them through all the background checks with the
Yes,
state.
that's what. Yeah.
There's 2 or 3 different caregiver data registries with the state
Okay.
that we run their names
Awesome.
through. Check their driver's license. I mean, we vet to the highest possible extent that you can vet someone. So
That's very good to know because there's a lot of, I mean, I've seen, and you know, you hear stories all the time and stuff like
all
that
the time.
happening.
And home care, and also I think one of the reasons why I did this is, you know, home care is no lie. I mean, you see horror stories
Yes,
for
yes,
home
you
care,
do.
and it gets a bad rap. And we don't always get it right, but we'll always fix the mistake, is what I tell people. And you know, I think that's all you can do in the
Right,
healthcare industry.
right.
It's a very hard industry. You know, it's not. You're dealing with emotions on both sides of the business. You know,
Right.
there's not an article of clothing, you know, somewhere in the piece, somewhere in the
Right,
mix. You know,
right.
you're dealing with your patients have feelings
Yes.
and your staff have feelings.
Right.
And so it's a hard business, and all you can do is, I think, just, you know, be honest and upfront with people. Like, we're gonna make mistakes. We're humans.
Right.
And you know that, I think home care has gotten a bad rap, but you know, we've kind of made it our mission to provide a higher quality of care. That doesn't mean we always get it right, but you know, we can promise you that we'll make it right.
That sounds amazing. Well, Ryan, thanks for joining us.
Yeah,
and if
thanks
you
for
ever
having
want
me.
us to come back, I love Lexington. I love the atmosphere, big city. And Michael was laughing at me when I said big city. He said, "This is not big." He's from Hawaii, so
Oh yeah.
you know, and he's experienced California and all that. So,
Yep.
but BrightStar Care people, say the website for them in the camera.
Yeah,
please.
it's brightstarcare.com, and when you go to that website, you can search Lexington, and our specific location will pop right up, and you can get our number off there. I can also tell you our number. It's 859-227-9008. You can call that number at any time to get any of your questions answered.
All right. Well, it's a wrap.
Thank you.
Thank you.